So remember, an increase in potassium permeability moves membrane potential closer to potassium's equilibrium potential. In fact, this is what also creates the hyperpolarization phase of the action potential, where we're more negative than rest. This is only possible because we have greater potassium permeability than we did at rest. And that's because we have the leaky potassium channels that are open all the time, but now we additionally have the voltage-gated potassium channels open as well. And that's what creates repolarization. We can't really see it that well in this particular image though. Now the voltage-gated sodium channel that we've also been looking at in the previous video is trying to show us too the transition from the inactive state back into the closed state. This is actually happening anytime that membrane potential is back below threshold and continues through the hyperpolarization phase as well. You could think of it as sort of like a reset type of step. Now, here's another image that's trying to correlate the different phases of the action potential to ion permeability through these different channels that I've been talking about. It covers all the same information that we've just talked through, and so I'm not going to talk through it again, but you may find this alternate view, which is talked more about in the book, helpful, just for getting a different perspective of the same information, especially if you want to take a closer look at what's happening with the potassium channels. Now, usually at this point in the lecture, people start to wonder why it's necessary to talk about the action potential in all of these different types of channels in this amount of detail. So for a little perspective, I want to show you a quick video about a girl with a disorder called congenital insensitivity to pain, or CIP.
First in this half hour, an inspiring story about a young girl with a condition so rare that no one, not even experts, know how many people it affects. It's known as CIPA, the inability to feel any physical pain. And that 12-year-old girl is using her diagnosis to make a difference. GMA special contributor Cameron Matheson had a chance to spend some time with her. Here's her story.
What if pain, the thing that parents try hardest to protect their children from, what if that was the thing your child needed most?
Everyone's like, oh, what a good baby you have. But as time went on, the red flags started going up.
From the moment she was born, Ashlyn Blocker didn't cry when she was hungry or had diaper rash, or even when, at just 8 months old, her parents took her to the eye doctor.
When they put the dye in her eye, everyone just kind of gasped. She had a big corneal abrasion across her eye. They were astonished she wasn't in pain.
It was then her parents got the shocking, devastating news. Their baby couldn't feel any pain.
It was scary because, there weren't very many good outcomes that were involved with this condition. People passing away from appendicitis because they didn't have the warning signs, and bone infections.
I understand that the toddler years were some of the worst, where she would continue to injure herself.
Yeah, the biting, her burning her hands, different things. Tara actually would wrap her hands up with athletic tape. She'd be our little boxer.
Photo after photo document injuries that pained her parents, but not their little girl. What is it like for you to send her out the door every day, knowing what can happen without you there to watch?
Now I'm going to stop the video before things get a little bit too sappy, but you get the idea. She's unable to feel physical pain. So people with congenital insensitivity to pain are still able to feel other types of pain, like emotional pain, but just not physical pain. And so even though at first not feeling any pain might seem great because no more ouchies, pain does serve an important function inside the body. It helps us to become aware of things that might potentially be harmful to us. So someone that has CIP might not realize that they have appendicitis until their appendix ruptures. For this reason, CIP has a pretty high overall general mortality rate, but it's even higher in men. And that's not necessarily due to any inherent biological difference. It's more because boys tend to get really excited about not being able to feel pain and then do all kinds of stupid things, like have their friends punch them in the gut or jump off of the roof of their house to try to impress people. Anyway, CIP is one extreme example of a pain disorder. And pain disorders are on a spectrum, and many of them are caused by changes to the voltage-gated sodium channel. CIP is the most extreme because the voltage-gated sodium channel is essentially non-functional. And so the pain neurons are never able to fire an action potential, which means that information about pain is never able to be relayed to control centers inside of the brain. At the opposite end of the spectrum are the extreme pain disorders. So in this situation, even the lightest touch sensation can produce really extreme pain. And this is caused by a different mutation in the voltage-gated sodium channel that causes action potentials to fire more frequently instead of less frequently. Now, people have studied pain disorders for a long time to try to develop better ways to treat pain. There's been a lot of renewed interest in this lately, especially due to the opioid epidemic. We know that drugs that are based off of sodium channels are not as addictive as ones that affect brain chemistry, like morphine or OxyContin. One example that many of us are familiar with is lidocaine, which is what the dentist uses to numb your mouth so you can't feel them drilling your teeth. All of those anesthetics that end with cane are inhibitors of voltage-gated sodium channel activity. But fortunately, they're reversible, and most of them can be applied topically or locally inside of the area that's being worked on by the dentist.